Massage and acupressure to prevent and treat type 2 diabetes. Hi. Diabetes is a chronic medical condition characterized by the inability of the person's body to regulate blood sugar levels effectively. This metabolic disorder can lead to many different health complications and is classified by medicine into many different types, the most common of which are type 1 diabetes and type 2 diabetes. In fact, managing diabetes often involves careful monitoring of blood sugar levels, lifestyle modifications, and in some cases, medication or insulin supplementation therapy. Today, to contribute another solution, I would like to give you a relatively simple acupressure massage exercise that is very effective in dealing with type 2 diabetes. Hopefully, this exercise will help you. If you are still healthy, it has a preventive effect, and if you have some signs of type 2 blood sugar disorder, it can contribute to preventing and effectively reversing this very difficult disease. If in the previous acupressure massage lesson, the acupressure for diabetes lesson is also to treat diabetes, I have introduced to you a set of 3 classic acupressure points to treat diabetes. The Senyingio acupoint, the DG acupoint, and the Zhangmen acupoint. Then in this exercise I will introduce to you another set of 4 acupoints including the Gongsun acupoint, the Senyingio acupoint, the Shuahai acupoint, and the Lai Ke acupoint. Specifically, please pay attention and practice with me. To practice massage and acupressure to facilitate this exercise, the most appropriate position is to sit on a sturdy and comfortable recliner like this one. Each of us has 2 Gongsun acupoints, 2 Senyingio acupoints, and 2 Shuahai acupoints located symmetrically on both legs. And the 2 Lai Ke acupoints are located symmetrically on both hands. We will press and massage these acupoints sequentially in a circle, starting with the Gongsun acupoint on this leg and finally ending with the Gongsun acupoint on the other leg. Here, I will start with the right foot. You can also start with whichever foot you want, but if there is no problem, you can also start with the right foot like me for convenience. Now, we'll start with the Gongsun acupoint on the right leg. This is the location of the Gongsun acupoint on my right leg. The Gongsun acupoint is the 4th acupuncture point located on the TUC Taiyin spleen meridian, located on the lower border of the first metatarsal bone, at the junction of the skin of the sole of the foot and the skin of the instep. About 1.5 cun behind the joint at the base of the big toe. You can also review in more detail the location and how to get the Gongsun acupoint in video SP4. Here, this is the location of the Gongsun acupoint. It is located on the boundary between the skin of the instep and the skin of the sole of the foot, and about 1.5 cun from the joint at the base of the big toe. According to Oriental medicine, the Gongsun acupoint has the effects of tonifying the spleen, benefiting the lower intestines and regulating the stomach as well as the entire central region. The Gongsun acupoint is not only often prescribed to treat gastrointestinal diseases such as chronic dysentery, acute and chronic gastritis, but is also very effective in combination with other acupoints, including there is a Senyingio acupoint in the treatment of blood sugar disorders that we will practice in today's exercise. To effectively apply the Gongsun acupoint, you can place your foot sideways on the chair like this. Then, use the tip of your thumb like this to press directly on the acupuncture point. You can use any fingertip you want, but it is best to use the thumb tip on the same side as the leg because it is easy to have the same tilt and therefore the effect of penetrating the acupoint will be best. Here we are pressing the Gongsun acupoint on the right foot, so pressing the acupoint with the tip of the right thumb will have the best effect. I press and rotate my fingertips like this. The pressure is relatively strong but not too strong, enough to cause positive pain, deepen the acupoint, and within your pain tolerance limit. In a sitting position like this, you can press the Gongsun acupoint for about 3 to 5 minutes to increase the force of acupressure and to reduce hand fatigue. You can use your left hand to help press on top of your right thumb like this. For acupressure to be most effective, in addition to practicing the correct technique, it must be practiced in a peaceful mental state, avoiding stressful mental states, being too preoccupied or thinking too much about one topic, something unwanted. After about 3 to 5 minutes of pressing the Gongsun acupoint like that, now we still use the tip of this thumb, gently rubbing the acupoint for a few dozen seconds like this before moving on to the next acupoint. Now, please join me in moving to the next acupressure point, also on the right leg, which is the Senyinjiao acupoint. This is the Senyinjiao acupoint on my right leg. The Senyinjiao acupoint as well as the Gongsun acupoint are located on the spleen meridian and it is in the 6th position. The Senyinjiao acupoint is located on the inside of the lower leg, close to the posterior edge of the tibia, and about 3 cun from the top of the ankle. You can review in more detail the location and how to get the Senyinjiao acupoint in video SP6. The Senyinjiao acupoint is a very special acupoint because of its diverse medicinal uses. Perhaps that is why from ancient times to the present the Senyinjiao acupoint has always been a very active research topic. According to Oriental medicine, the Senyinjiao acupoint has the effect of tonic yin, strengthens the spleen, clears stagnant air, relieves rheumatism, relieves wind, regulates blood, strengthens the liver and benefits the kidneys. The Senyinjiao acupoint is often prescribed to treat leg pain and swelling, diseases of the motor nervous system, diseases of excretion, genitals, gynecology, obstetrics, etc. In addition to classical Oriental medicine applications, today the Senyinjiao acupoint also receives special attention for deeper and broader development. The Senyinjiao acupoint is used to effectively treat diseases related to urinary disorders, bleeding and inflammation of the genital organs of both men and women, thrombophlebitis, and urinary tract disorders, blood pressure disorders, etc. And especially, the Senyinjiao acupoint is also used to effectively treat blood sugar disorders and type 2 diabetes. To effectively influence the Senyinjiao acupoint, we can also apply the same pressing and massaging method as for the Gongsun acupoint mentioned above. Specifically, we can also use a thumb tip like this to press directly on the acupuncture point. Here for the Senyinjiao acupoint, because the acupuncture point is relatively wide and very easy to influence, we can freely use the fingertips as desired. The left or right thumb tip is both good. You can even use your knuckles like this to press directly on the Senyinjiao acupoint. The best way to press the Sanyingio acupoint is also to press, release, and combine it with a circular fingertip like this. The time of pressing, releasing like that continuously lasts about 3 to 5 minutes. Before finishing, we still use the tip of our thumb, gently rubbing the acupuncture point like this for a few dozen seconds. Now let's move on to the next acupressure point, the Shuahai acupoint. Here, this is the Shuahai acupoint located on my right leg. The Shuahai acupoint is located on the inside of the thigh, about 2 cun from the kneecap. Here, we sit with the thigh perpendicular to the lower leg like this. From the middle of the upper edge of this kneecap measure up 2 cun, then measure 2 cun inside the thigh. This is the position of the Shuahai acupoint. You can also refer to many other interesting and useful details related to the location and how to identify the Shuahai acupoint in video SP10. Because the location is easy to determine and impact, and the area receiving pressure stimulation of the acupoint is relatively large, the way to impact the Shuahai acupoint is relatively simple. Specifically, you can use the thumb of your right hand like this to press and press on the acupuncture point. You can also use your left hand to support your right hand like this to reduce fatigue. The acupressure method here is also pressing and releasing, combined with rotating the tip of the thumb like this. The time for continuous pressing like this should be from 3 to 5 minutes. Before finishing the day pressing the Shuahai acupoint, we also use the tip of our thumb to gently press on the acupoint like this to massage the entire area of muscle tissue that has just been affected. Now, we move to impact an acupuncture point located on the hand, still the right hand. That is the Lai-Kei acupoint. Here, this is the Lai-Kei acupoint on my right hand. The Lai-Kei acupoint is the 7th acupuncture point located on the lung meridian. According to Oriental medicine, the Lai-Kei acupoint has the effect of clearing the lungs, eliminating leprosy, and clearing the circulation. The Lai-Kei acupoint is often prescribed to treat painful diseases such as glaucoma, respiratory diseases such as cough, asthma, nervous system diseases such as hemifacial paralysis, and eye diseases, neck pain, diseases related to excretion, etc. And for type 2 diabetes. The combination of the Lai-Kei acupoint of the lung meridian with the above 3 acupoints of the spleen meridian has also been widely applied by physicians. Effective not only in Eastern countries but also in many Western countries like Europe or North America, for example. To massage and press the Lai-Kei acupoint effectively, there are many ways to take the acupoint. You can refer to the relevant details in the LU7 video. However, you can also find the Lai-Kei acupoint in a simple way as follows. The two hands are interlocked like this. The index finger of one hand is placed on the inner radius of the other hand. Here we look for the Lai-Kei acupoint on the right hand, so we place the tip of the left index finger on the inner border of the radius bone of the right hand. The Lai-Kei acupoint of my right hand is just below the tip of this left index finger. To influence the Lai-Kei acupoint effectively, you can use the tip of your left hand's thumb and press the Lai-Kei acupoint of your right hand like this. The pressure is moderate, enough to cause a positive and pleasant feeling of pain. Press and release and rotate your thumb like this. Continuous pressing like this lasts about 3 to 5 minutes. Before finishing the process of rubbing and pressing the Like-A acupoint, we also use the tip of this thumb to gently rub and rotate, massaging the acupoint that has just been pressed, for about a few dozen seconds. At this point, we have finished pressing the acupoints on the right side of the body, including 3 acupoints of the spleen meridian located on the right leg, the Gongsun acupoint, the Senyinjiu acupoint, and the Shuahai acupoint, and 1 acupoint located on the lung meridian, is the Like-A acupoint. So we have gone half a circle. And now we will continue to go through the remaining half of the circle, also following the methods of identifying acupuncture points, rubbing, pressing and massaging acupuncture points in the same ways as above, also in the same time periods from 3 to 5 minutes for each acupoint, and in order. The Like-A acupoint on the left hand, the Shuahai acupoint, the Senyinjiu acupoint, and then ending at the Gongsun acupoint on the left leg. You can rub and press acupressure points like this a few times a day if you have symptoms of type 2 diabetes, or a few times a week if just for prevention purposes. You can do acupressure and practice in your free time and in a good mental state, persistently and consistently. At the same time, you must also strictly follow your doctor's specific instructions regarding diet, work, rest and exercise in a reasonable and scientific way. Hopefully, with a positive spirit, serious attitude, diligence, you will gradually push back the disease as far as possible, minimizing the negative consequences of diabetes itself caused by sugar. Wishing you joy, health, and happiness. Thank you. Goodbye, and see you again.